Hi, welcome back to my channel. I'm Dr. Aziza Sisse, a GP with a specialist interest in women's and gynecological health, and we're back with the myth busting series. Today's topic is super important: ovarian cancer. We're covering 5 myths. Myth number 1: ovarian cancer is a silent disease. This is not true. Though ovarian cancer is often diagnosed at a later stage, it does cause symptoms. Please remember this acronym: BEAT. B for bloating that persists for 3 weeks or more, E for eating less or feeling fuller quicker, A for abdominal pain or lump, and T for toileting changes. So this is either passing more water than usual or a change in your bowel habits. These symptoms can be vague and are often associated with other conditions such as IBS, which plays a part in why ovarian cancer diagnoses are often made late. So if you experience any of the symptoms mentioned for 3 weeks or more persistently, please see your doctor for further assessments and see them as many times as necessary. Or see another doctor if you feel dismissed. Please always trust your gut. Please also remember that having these symptoms does not automatically mean that you have cancer, but it's always worth getting checked out to rule it out. And if it does turn out to be cancer, which is rarely the case, the hope is that it's picked up early, where treatment is more likely to be curative, less invasive, and successful. Early detection saves lives. Myth number 2: cervical screening tests for ovarian cancer. Cervical screening, smear tests, pap smears, they do not test for ovarian cancer as many people assume. If you have the symptoms mentioned earlier or your recent cervical screening was normal, please see your doctor. There are specific diagnostic tests done to check and diagnose for ovarian cancer, so it's really important that you're aware of the symptoms and get assessed as soon as possible. These usually include blood tests to check for a tumor marker called CA125 and a transvaginal ultrasound scan. Myth number 3: ovarian cancer only affects older women. Ovarian cancer is more common in older women who've been through menopause, but it can and does occur in much younger women too. Approximately 20% of ovarian cancer cases occur in women under the age of 50. That is 1 in 5. So please don't ignore your symptoms, whatever your age, and always get checked. Myth number 4: it only affects those with a family history of ovarian cancer or have a BRCA gene mutation. BRCA stands for breast cancer gene, which is a tumor suppressor gene, and this means that it stops cancer from occurring. When there's a mutation in this gene, it's associated with ovarian cancer, breast cancer too, and in individuals who have BRCA gene mutations, 1 or 2, they have a 35 to 60% risk of developing ovarian cancer. And those with a family history of ovarian cancer or Lynch syndrome, which is an inherited condition that increases a person's risk of several types of cancer, have an increased risk of developing ovarian cancer. That being said, ovarian cancer can occur to anyone with an ovary, and in fact, the majority of ovarian cancer cases occur in women with no family history at all. Other risk factors for ovarian cancer include increasing age, obesity, smoking, having endometriosis or diabetes, and taking hormone replacement therapy. Myth number 5: ovarian cancer is always fatal. While ovarian cancer sadly has a high mortality rate, especially when diagnosed at a later stage, it does not always lead to poor outcomes. Survival rates vary depending on factors such as the stage of the cancer at diagnosis, the subtype of ovarian cancer, and the individual's overall health. Early detection and treatment can improve outcomes and increase the chances of long-term survival. In fact, at its earliest stage, more than 90% of people diagnosed with ovarian cancer will live 5 years or more. I hope that you found this useful. Please share this with your family and friends. Remember, spreading awareness, finding out, and reducing our own individual potential risk, getting checked as early as possible when we notice symptoms, can truly save lives. It's always a good time to raise health awareness. Thank you so much for watching. Please don't forget to hit that subscribe button and turn your notifications on so you catch me on the next video as soon as it comes out. And don't forget to send me some questions in the comments and I'll get to answering them as soon as possible. Bye!